Adam McDaniel, and I'm the segment manager for Henry Schein Practice Solutions over Dentrix Ascend, and I'm here with Dr. John Flucke. Great to be with you today and talk to you a little bit about our new product, Dexis for Dentrix Ascend. It's our new cloud-based imaging.
Okay. I'm John Flucke. I'm a technology editor and chief dental editor for Dental Products Report, and I'm excited to see what developments. I've watched Dentrix Ascend grow from the day it was announced until right now, and Adam has got some great improvements. Dentrix Ascend improves on almost a weekly basis, which is one of the joys of a system that uses the cloud as its delivery system. So Adam, let's get to it.
Great. So I want to talk to you just a little bit about when we think about imaging. One of the most important things is to know what teeth numbers have images, but when we thought about it from a Dentrix Ascend point of view, we thought, what's more important about knowing you have images, but also how old those images are. And so sure, you can highlight this and click on this to view the related images to the tooth, but you can also see the age of those images, and as the age gets older, those black dots fade to white. So as a dentist, it's really important for you to be able to come in and see, do I have a recent image on this tooth? And if you see that that's a light gray image, you know that you don't have a recent image, and you can then go in and get a better image.
And that makes good sense, because a lot of times, as a practitioner, you see so many patients that you don't remember when was the last time we took an image. And you may do a restoration on a tooth, and you may, then ask an assistant. If somebody comes in with pain, you may say, well, let's take a PA on that. And before you do, you look in the chart and you realize we took a PA, 30 days ago. Well, that's not going to probably show much today in a change from that. And so this gives you the ability to look at the chart and almost instantaneously know whether you've got that room or whether you have a recent image of that. That's beautiful.
That's exactly right. Now with Dexis for Dentrix Ascend, what we did is we really combined the imaging system into the practice management system. So instead of a separate bridge or a separate system, we've made it part of your practice management system. We have something in Dentrix Ascend we like to call the digital clinical workflow.
Okay.
So when you're taking images or acquiring images in traditional practice management and traditional imaging, the acquisition of images and the actual posting of the procedure code is completely separate. With Dexis for Dentrix Ascend, you can actually see that we put the procedure codes right here by the imaging that you're taking.
Nice.
And we automatically post those procedure codes in the patient's chart, update their ledger, and what's really cool is we update their recare, because clinical radiography and actually doing preventative maintenance is taking x-rays. And so we want to update that patient's recare so that you know when you need to take new images.
Nice. And so you've got all that built in, so whenever you take an image, if you take a pan, it updates it across the board with everything where the pan update information needs to be found.
Yeah, if you think about it, studies have shown that two things happen in a dental office in regards to imaging. Number one is that when you take those images, you typically forget to post those in the patient's record for a procedure code.
Right.
And then the second thing is, to update the recare, it takes a few minutes to update recare.
Right.
Now with Dexis for Dentrix Ascend and Dentrix Ascend together, we automatically update the patient's record for you.
Okay.
So you don't have to worry about it. You just take the x-ray, everything else gets posted in the record for you. And that's what we're calling our digital clinical workflow.
Well, and see, I think that's huge, because a friend of mine, Dr. Charles Blair, has told me that their estimate with what he does, number crunching for dentistry, is that the average dental practice probably leaves $100 off of the books every day.
Yeah.
And when you think about, if you see patients 4 days a week, that's $400 a week times 52 or thereabouts. That can be a healthy chunk of practice revenue that simply doesn't get billed.
That's right. And this one, you automatically post those procedures. So if I'm taking a PA, for example, I choose the tooth number. Notice down here you've got that D0220.
Yes.
And I've got the ability to bill the patient and bill the insurance from the provider. So when I go to capture that, I go ahead and proceed with acquisition, and I go ahead and acquire that image. What's really cool is it gives me a quick preview of the image, but notice right there, see that green thing?
Yes.
The procedure has been posted. Now what's really cool is I go now to the patient's ledger. the financial record, and look at that. That PA D0220 has been posted and charged appropriately with the correct dentist and right to the patient's record. It's that easy. You don't have to manually enter that.
Yeah, so in most systems, you know, you would go through and you would take that image, but then you've got to remember to go down and click and literally tell the front desk,
right,
you know, your admin team, that we've done this procedure and that it needs to be walked out.
Exactly.
So it's a two-step process, and with the send, it becomes just basically a one-step process. Take the image
right,
and everything else takes care of itself.
That's exactly right. That's exactly right. Yeah, and again, when I now go to the clinical record, now we've got that PA right there. Notice the little icon. I can bring up the PA that we just took from the progress notes.
Nice.
I don't have to jump into the imaging system to view it. It's just right there on the screen for me.
Yeah, so it's all in one place, and that's something that I think is huge. I don't want to have, you know, software where I have to click on one thing to get the ledger and another thing to get imaging and something else to get clinical notes. I want it all in one place, one software that does it all.
That's exactly right. Yeah, and so that's really Dexis for Dentrix Ascend. I mean, they're obviously support for a lot of different hardware devices based on the hardware that the office has for intraoral cameras, sensors, pans. All of those things are supported. We also have the tools like annotating and being able to change the image, rotate it, attach it to insurance claims. All of those standard features that you would expect from an imaging system are all built in there. And the great thing is you can use it on your PC, you can take images on your Mac, you can pull them up on your iPad, because that system integrates the full patient record so you can access it wherever you are.
Right, and that's kind of the joy of having things with a cloud-based system, is that the cloud is agnostic. It doesn't care how you access it, because you're not really running any software other than a browser on your computer. You're simply running it off of, just like you would on a travel website or a banking website. You know, we do online banking, and I didn't need to download something from Bank of America to do online banking. You just go and access it over the internet.
Yeah.
And the one thing I want to close with that I really have been impressed with today is that Dentrix Ascend is not just Dentrix in the cloud. Ascend is its own system, its own database, its own everything. So it's not just something that if you have Dentrix, it's just like Dentrix, only it runs on a computer in the cloud. This is something completely different. And I'm very impressed with what you guys have done.
Well, thank you. I appreciate you stopping by today.